following dramatization presents a reflective scenario. It's not intended to model, but rather to promote critical reflection and group discussion about the importance of being centered in our work. As you watch the segment, consider the following questions. What is happening? What issues does it raise? What emotions come to your awareness? What implications does it have for how we practice?
When I was first starting out in nursing, I used to barge into a hospital room without really thinking about what was going on behind the door. But thankfully, there was one family, one person that actually made a difference for me. It happened one night when I was on a busy evening shift. I was behind in my rounds, so naturally I was in a hurry. Later that evening, when things had slowed down, a patient's daughter asked me if we could talk. I had a few minutes, so I said yes. That's when she told me she'd been taught that a person nearing the end of life needs to be in a space that is kept sacred. Held sacred so that the ancestors will feel comfortable to come and help with the journey the loved one will make to the other side. Without quiet and stillness, her mother might not feel the presence of the ancestors and might wonder if she's been deserted. She asked me if I could carry out my duties more quietly and gently. Actually, I remember exactly what she said. Make a smaller ripple in the energy of the room. Now, no matter how busy I am, I always stop, look, and listen. I stop or just slow down a little before I enter a patient's room. As I enter the room, I take a moment to look at what is going on. I take the time to connect with the family and the patient's experience coming from a place of compassion. I do the best I can in the moment. Then I listen. I listen to what is going on in the moment. I listen to my own emotional state. Am I rushed? Stressed? Am I tired? And finally, I check my mind. What am I telling myself? What am I thinking? Then I calm myself and stay as quiet as I can inside.
As the scenario illustrates, it really doesn't take much more time to briefly stop and reflect on where we are at in the moment when engaging patients and families experiencing life-threatening and life-limiting illness. We are constantly challenged to balance the physical, psychological, social, spiritual, and practical needs of our patients and their associated expectations, needs, hopes, and fears. Being constantly mindful and considerate of a range of expectations, traditions, and a patient and family's specific experience with an illness can have a significant influence on preventing new issues from occurring. It can also contribute to a care setting that promotes personal and spiritual growth as well as important life closure tasks.